question. Like this example where which you were showing before about so in this case the baby can be with the head downstairs, but his head is still not deep enough, right? This is not the case when the baby's head is upstairs.
Okay, this is so you are talking now because I know you told me before that your baby is with a pelvic down and the head of baby is up. You are 36 weeks, so we have now the opportunity to do something, but you can also give a birth with a pelvic. So that means this could be also pelvic of your baby.
Okay.
Yeah, and the head is up. So this is possible only if your baby is not huge. And you can discuss that with the hospital. Are you going to do that? Some women or some medical staff are advising to do cesarean section. Very individual decision. What you can really do now, and we should start it tomorrow, to do soft turning the baby. And this is Moxibustion, coming from traditional Chinese medicine, making your 1 point on your small toe hot, and your baby is going to move. This treatment is giving impulse your baby to move, and if you have enough space, maybe the baby is going to come in a proper position. Maybe there is something in the way or the cord around the neck and there is not possible. Why we call it soft turning. I developed a special program for turning the baby, which includes 4 things, 4 therapies, and we are 80% successful. Optimum is to start a little bit earlier than you, but your baby is not that big, it's also possible now. Perfect is to start in 34 weeks, and we do 6 days heating this point, taking the blood, see the level of magnesium and vitamin D. We give a magnesium really high dose to be really almost on the upper part of the normal range, because this is relaxing your uterus. Then we give you 2 till 3 times a week acupuncture to relax your mind and to relax your muscles, because if you are relaxing, the moving of your baby will be more successful. Because if you are tense, either psychologically, and then your muscles are also tense, or your muscles are tense because you have lack in magnesium, which is very common, your baby don't have chance to turn that highly, yeah? And the 4th thing is the breathing for relaxing. You need to do really regularly at home this breathing, what I explained you for 6 and twice inhale and exhale longer. These 2 types of the breathing, which is suiting you more or both of them. So we should start then tomorrow, and this is like I can explain you everything what we are going to do. So you will be lying relaxed down. You take your socks off. We have a cigarette of Moxibustion, some type of herb, and this is coming with our hands very close to your small toe, and the side effects could be that you get burnt, but this is good for the therapy, not good for your toe, but doesn't harm the baby or you. It's even more stronger impulse, but never happens in over 10 years. So we are holding this cigarette, and the heat should be very, very strong. The stronger it is, the stronger is it, the more efficient will be. We do that for 15 to 20 minutes, and every day 6 days. Then on the 7th day or 8th day, you make appointment to see a gynecologist with ultrasound. Has it turned? If not, with another session with you. To be honest, I think we are 36 weeks. We can do, because your baby is not big, but I don't think we will do another turn. And is it also that a lot of successful turning in hospital are done very simple, only to push a little bit baby. Some gynecologists are doing that really gently and nicely after we do this therapy. So if you have the appointment in hospital that they check it, make an appointment maybe if it's possible that we do before Moxibustion and acupuncture, and you are relaxed, and maybe they move a little bit with gentle touching the baby, and the baby is turning. And even though if they can't make it there, if you have a really proper turning in hospital, in a environment prepared for cesarean section, which could happen if something goes wrong, it's also higher rate that we make it. Yeah. And I recommend you already now to take high dose in magnesium citrate, 600 milligrams a day, maybe 3 times 200 or twice 300 milligrams. And we check your blood test tomorrow, and vaginal test, and you do acupuncture and Moxibustion. You have full range of the therapy, but for you will be very relaxing. Not a big deal, yeah?
Okay.
Yeah, this is about turning your baby.
Okay. And let's say if, I mean, I hope that the baby will turn, and I'm almost sure that the baby will turn, but let's say the baby didn't turn, and during the labor, the baby is lying
with the pelvic down.
Exactly, yeah, and let's say we try to give birth like this. So let's say in this moment, does the baby get enough oxygen because his head is inside the womb, and yeah, so like, is it? I mean, it's not...
while your baby is in uterus, all the time will get enough oxygen. There is no any reason why it shouldn't, which is correlated to pelvic down.
Okay.
This is no question. The question is, when you give a birth and your baby is coming out, let's say this is the pelvic, yeah? And pelvic is coming down, and now the body is coming. So the head of the baby shouldn't be longer inside, should be also immediately coming. That's why it's important, because the head is bigger than the pelvic, and there is some risk. That's why they measure everything. If the baby is too big, that what to do then? Then it's really problem. That's why they are measuring the diameter and see, is it possible? And if they say it's safe, I would do. I wouldn't, personally, it's my personal opinion, if this is not done. If this is not done, or if it's done and the baby head is bigger than pelvic, I would do cesarean section. That would be my decision. Okay. Yeah? So there is no point, there is no worrying about being here inside. This is your uterus, and this is the pelvic, and up is the head, or here is the head, up. No worries. This position doesn't have any other risk than other positions to heart rate of the baby or oxygen, yeah? But it has risk during the coming out. So this is the only risk, which is a huge risk if the head is bigger than your diameter of the pelvic.